And it is a great opportunity for us to welcome everybody present in this virtual room. Dr. Salil, मैं आपसे रिक्वेस्ट करूंगा कि आप इस प्रोग्राम को आगाज दें और शुरुआत करें.
थैंक यू कमोडोर रमन. गुड इवनिंग, नमस्ते सबको. मैं डॉक्टर सलिल भार्गव हूँ. कोलैबोरेशन टू एलिमिनेट टीबी अमंगस्ट इंडियंस की तरफ से मैं इसका को चेयर हूँ और मैं आप सबका आज के इस प्रोग्राम में स्वागत करता हूँ. आप सब जानते हैं ये जो प्रोग्राम है आज ये इनॉग्रेशन है, बूस्टिंग टीबी नोटिफिकेशन, जो हमारा एक प्रोग्राम है जो अगले कुछ महीनों चलेगा, जिसमें हम सब साथ साथ चलेंगे. सो अगले 1 से 1.5 घंटे में हम आपसे कुछ इस प्रोग्राम के बारे में बात करेंगे और आपको बताएंगे कि हम इस प्रोग्राम में क्या करने जा रहे हैं. मैं ये बातें, हम सब लोग अलग अलग लोग आपसे बातें करेंगे, आपको बताएंगे इसकी क्या जरूरत है और क्यों किया जाना चाहिए. इसके पहले मैं स्वागत करता हूं कमोडोर रमन का, जो मेरे साथ इस प्रोग्राम को होस्ट करेंगे. मेरे को होस्ट हैं. कमोडोर, आपका स्वागत है.
Thank you, Dr. Salil. Thank you so much. And I take this wonderful opportunity to welcome all the STOs, DTOs, WHO consultants, staff from Central TB Division, all the wonderful counselors from 16 colleges and universities across the country, and many other wonderful people who have joined us here, friends from API, friends from Emory. Welcome you all. A hearty welcome to all of you. Dr. Salil.
तो जैसा मैंने आपको बताया कि ये प्रोग्राम एक अलग तरह के विषय को, टीबी के जो टीबी प्रोग्राम है हमारा नेशनल टीबी एलिमिनेशन प्रोग्राम, इसके एक महत्वपूर्ण पहलुओं के लिए हम लोगों ने ये ऑर्गेनाइज किया है और इसका आज इनॉग्रेशन है. तो सबसे पहले चलिए हम सबसे पहले जैसे हम अपने भगवान को याद करते हैं, माँ सरस्वती की पूजा करते हैं और दीप प्रज्वलित करते हैं, तो आज के कार्यक्रम की भी शुभारंभ हम इसी के साथ करते हैं.
So thank you, Dr. Salil. And as we await for DDG Central TB Division to arrive, it will be a good opportunity for us to welcome the guest. And Dr. Salil, if I may ask you, how did CTI start and what was your vision and dream that you have come to this day today?
थैंक यू कमोडोर रमन. मेरे से ज्यादा महत्वपूर्ण तो ये था कि मैं आपसे पूछता कि आप हमारे साथ कैसे हैं, लेकिन मैं अभी फिर आपसे बात करता हूँ. मैं ये बता दूं, हम और मनोज पिछले करीब 15 साल से एक सपना लेकर चल रहे हैं और वो सपना है कि हमारा देश टीबी मुक्त हो. मेरा ही नहीं, हम सबका है, जितने लोग यहाँ हैं मुझे मालूम है. और मैंने अपनी जिंदगी एक डिस्ट्रिक्ट टीबी ऑफिसर की तरह प्रारंभ करी थी और तब से मेरे मन में ये ख्याल आया कि इस बीमारी से हमको, इस दुश्मन से कैसे जल्दी से जल्दी निपट सकते हैं. और तभी मनोज और हम लोग जुड़े थे और तब हमने एक इस ग्रुप की और इस ऑर्गेनाइजेशन की स्थापना की थी, जिसका नाम है, आप समझ सकते हैं, कोलैबोरेशन टू एलिमिनेट टीबी अमंगस्ट इंडियंस. और तब से हम लोग साथ साथ चल रहे हैं. मैं आज मेडिकल कॉलेज में प्रोफेसर हूँ. आज अपने स्टूडेंट्स को, अपने दोस्तों को, मीडिया बंधुओं को, सबको ये बताता हूँ, सबके साथ कोशिश करता हूँ कि कैसे हम जल्दी से जल्दी इस देश को, इस विश्व को, इस पृथ्वी को टीबी से मुक्त कर सके. लेकिन कमोडोर रमन, महत्वपूर्ण यह है कि आप हमारे साथ कैसे जुड़े. मैं आप दोस्तों सबको बता दूं 2 मिनट में, क्योंकि कमोडोर हमारे साथ लंबे चलेंगे. आप सोच रहे होंगे कि ये यहाँ पर क्या कर रहे हैं, इनका क्या रोल है यहाँ पर. दोस्तों, कमोडोर रमन ने भारत के लिए दुश्मनों से कई साल तक लड़े हैं ये, और अब हमारे साथ इस दूसरी बीमारी, दूसरे दुश्मन से लड़ने के लिए हमारे साथ है. कमोडोर रमन, आप भी आपके बारे में कुछ बताएं और फिर हम आगे बढ़ते हैं हमारी बात को लेकर.
Thank you so much, Dr. Salil. You have given a great introduction. And there will be so many occasions for me to interact with all the DTOs over the next 8 weeks. And there'll be so many chances to introduce ourselves. But today, let us, because the DTOs may be thinking that, here is one more program. Here is one more burden. Here is what these guys are going to bring, which will help us eradicate or eliminate TB from this country. So first of all, I take a vow. I take a vow that I will always back from the side of the DTOs. I will always talk, conceptualize, and conduct everything from the perspective of the DTO and not from that of the CTD or the government of India or the TB program. Why I say it? I say it, ladies and gentlemen, because I wish to start from the statement that we know that you, ladies and gentlemen, are already hugely burdened. You have a lot of responsibilities on your shoulders. You have to fight COVID, you have to fight TB, you have to be part of the district administration, the VIP visits, the earthquakes and the floods do not take your permission before they come and hit your districts. We are fully aware, and we promise to you that whatever we will talk will neither increase your burden nor take any extra effort from your side or any extra energy from your side. In fact, we promise to you that after undergoing this journey with us together, you will be only able to save your time better, accomplish goals better, have a much stronger team, much more efficient team, and all this at all times saving your time and energy. This is a promise that I make, and I thought that I should begin the presentation, begin this session with these thoughts so that you are now inquisitive to listen what we are going to bring for you. Dr. Salil, आप मेरी बात में कुछ ऐड करना चाहेंगे?
बिल्कुल, कमोडर रमन, मैं आपकी बात से पूरी तरह सहमत हूं। टीबी प्रोग्राम का अभी सबसे महत्वपूर्ण जो पार्ट है, नोटिफिकेशन है हमारा। मरीज जो भी डायग्नोस होते हैं उनको प्रॉपर्ली हमको मालूम पड़ना चाहिए, जो नहीं हो रहे उनको पिकअप करना पड़ेगा, और हम एक एक मरीज तक, एक एक व्यक्ति तक जब तक हमारी जानकारी नहीं पहुंचेगी, हम थोड़े से आधे अधूरे रह सकते हैं। और इसी चीज को ध्यान में रखते हुए ही हमने प्रोग्राम को प्लान किया है, बूस्टिंग टीबी नोटिफिकेशन। इसमें सबसे ज्यादा जो रोल रहेगा हमारे डिस्ट्रिक्ट टीबी ऑफिसर्स का रहेगा। इनफैक्ट हम लोग, मैं आपको बताना चाहूंगा, हम क्वालिटी पे सेटी पिछले कुछ करीब 1.5 साल से काम कर रहा है, और हम लोग कुछ कोर्सेज भी रन कर रहे हैं आईडीफीट के नाम से, यूनियन और यूएसएड की सहायता से। कमोडोर रमन, मैं चाहूंगा कि पहले हम चालू वहीं से करें अपनी बात। कुछ दोस्त, मुझे मालूम है, हमारे साथ अपनी बातों को शेयर कर सकते हैं कि क्या हम लोगों ने क्वालिटी के ऊपर सीखा है और कैसे हम लोग नोटिफिकेशन को बेटर कर सकते हैं, उनकी राय में जानना चाहूंगा प्लीज।
एब्सोल्युटली डॉक्टर सलिल, आपने बहुत बढ़िया बात कही। And before I start, and I started with the apprehension, the DTOs at now who have joined us, may be apprehensive and thinking what new we are going to bring and what will we tell and talk to them. So first I will introduce to you, ladies and gentlemen, the DTO of Diamond Harbor, Dr. Himadri Haldar. He is traveling right now. He so much wanted to talk to you, but he also started like this. He challenged the program. Okay, and he started with that note that whatever you are telling, if it has meaning, I will put it to use in my most difficult district. Let us hear what he had to say.
Hello, dear DTOs. Myself, Dr. Himadri Haldar, DTO Diamond Harbor District, West Bengal, is sharing my experience with you. Friends, TB elimination by 2025 is knocking at our door, but our resources are limited. Time is very short. How to achieve all these? It's a desperate situation, friends. And we all know desperate situation calls for desperate action. We desperately need to apply best possible management tools to improve the quality of NTEP in our districts. But how can we clinicians achieve all these? Well, professional development course offered by SETI is the perfect answer for this, friends. In this course, we get to learn to apply PDSA tool. This tool helps us in process mapping, gap analysis, action planning, goal setting, implementation and monitoring of the outcome, all in a single Excel sheet. This is wonderful. Trained by the eminent management experts and with mentoring and hand-holding support from the QICs, Believe me, PDSA would work wonders in the path of achieving our time-bound targets. During my course, I applied PDSA on one of my worst performing TUs called the Mandir Bazar TU of Diamond Harbour. And to my surprise, it really worked. I was able to achieve 5% increment in notification in 3 months' time. It was unbelievable, actually. So I strongly recommend the course for all of you. Let us all join hand and incorporate this wonderful tool called PDSA in the DNA of our program and achieve the target of TB elimination by 2025. Thank you, friends.
I wish to thank Dr. Himadri Haldar, DTO, Diamond Harbour. You see, he challenged it and he put it to use. PDSA. This is the word, ladies and gentlemen, that we will be repeating again and again as a quality tool. Dr. Salil, आपने देखा कि डॉक्टर हिमाद्री हल्दर ने सोचा था कि मैं 3% करीब बढ़ाऊंगा, 5% नोटिफिकेशन अपने वर्स्ट परफॉर्मिंग टीयू में उन्होंने बढ़ाया 3 महीने के अंदर, और कुछ नया नहीं किया, वही जो कर रहे थे, सिर्फ अप्रोच बदली. So with this, I think Dr. Shakti Singh Rathod is here with us. Am I clear?
या उनकी स्लाइड में हमको देख पा रहे हैं हम, डीटीओ खंडवा मध्य प्रदेश से.
Correct. I think Dr. Shakti Singh has joined. Dr. Shakti Singh, if you are there, Edwin, please unmute him.
Sir.
Dr. Shakti Singh, बहुत बहुत स्वागत है आपका. I take this great opportunity to welcome you. You have been busy and you have found time to come here. Dr. Shakti Singh has been part of this journey. Dr. Shakti Singh, may I request you, sir, to share your views about this journey, how it benefited you, and how it can benefit all the DTOs in the country.
Thank you, sir. Thank you to Salil Bhargav, sir, Manoj, sir, and Raman Arora, sir. I started this program with थोड़ा बहुत मेरे अंदर एक हेजिटेशन था कि मैं क्या करूंगा और ये प्रोग्राम कैसा होगा और क्या नहीं होगा, बट मैंने चूज किया कि मैं पीडीएसए में अपना जो नोटिफिकेशन है उसके अंदर HIV, शुगर, यूडीएसटी और अपना बैंक अकाउंट डिटेल्स, इसको टारगेट करके अपना नोटिफिकेशन का जो 100% पूरा क्राइटेरिया है वो पूरा करूं विद इन अ टाइम फ्रेम ऑफ टाइम. सो आई स्टार्टेड दिस विद इन 3 months. जो मेरा टारगेट था, जो मेरा इसका अचीवमेंट 60-70% होता था कि ये सारे क्राइटेरिया पूरे होते थे, उसको मैं 100% तक लेके गया. और इससे ये हुआ कि मेरा स्टेट में रैंकिंग मेरे डिस्ट्रिक्ट का काफी अच्छा हो गया. साथ में ही जब पेशेंट को टाइमली हर चीज मिलने लग गई तो उसने आसपास भी बताया कि नहीं भाई वहां पे काम बहुत अच्छा होता है. इससे मेरे टीबी का नोटिफिकेशन बढ़ गया, टेस्टिंग बढ़ गई, और इसकी वजह से मुझे एक लाभ ये मिला कि राइट नाउ आई एम विद इन 20 डिस्ट्रिक्ट्स ऑफ द स्टेट विच इज डूइंग वेल, 52 डिस्ट्रिक्ट्स में. तो ये कोर्स मैं सबके लिए रिकमेंड करूंगा कि ये कोर्स सबने ज्वाइन करना चाहिए, और इसमें से कुछ कंपोनेंट्स निकाल के आपके जो वीकर पार्ट्स हैं उनको एक आइडिया लेके उनका एक टारगेट बना के उसके ऊपर काम करना चाहिए. और अगर इस करने से हमारा नोटिफिकेशन बढ़ता है, हमारा टीबी एलिमिनेशन का जो सपना है सबका, हम सब मिलके निश्चित ही 2025 में इस देश को, हमारे राष्ट्र को टीबी मुक्त करेंगे. जय हिंद, जय भारत.
Thank you so much, Dr. Shakti. You have been such an inspiration. So now it is time for me to call Dr. Bhargav Dave. He is the DTO, the DANGS Gujarat. May I request Mr. Edwin to help Dr. Bhargav Dave to unmute himself? Dr. Bhargav, can you hear me?
Dr. Bhargav Dave, are you there? Can you unmute yourself and you can speak out, please?
Yes, sir. Can you listen?
Yes, we can hear. First of all, how are you, Dr. Bhargav?
Yes, sir. Fine, sir. Very well. Okay.
It is so nice to see you again. It has been 7-8 months now.
Yes, sir.
Sir, please, I ask you, what has been your journey and how did PDSA help you?
Yes,
Please
sir.
share with all of us.
Sure, sir. I joined as a DTO Dang in June 21, and simultaneously, within a few time, I will join this course, city program for DTO team. And as such, Dang is whenever as joined, the Dang is a remote place of Gujarat, which is which full of challenges of tribal district. And along with this course, I have learned many new topics like leaderships, situation analysis, and team supervision and monitoring. Very good topics are covered in this program. And also the faculties were very well nice experience, and they are giving me more motivations during this course. And as in this course, my PDCA was to increase the notification in all Dang districts, all 3 blocks, because the Dang is very behind in comparison of all districts of the Gujarat. So along with the help of QIC and all faculties of this program, I have successfully completed my PDCA on notification, or to increase the notification. So from this course, I have increased my confidence a lot, and this helped me for the future. And so I'm very thankful, and also recommending all the DTOs to join this course, and to so not for themselves, but they are for the district, for the state, and for the country, to increase the notification and to remove the TB, to make the state, country from TB, eliminate the TB. This course is very much helpful. Thank you.
Thank you, Dr. Dave. Dr. Dave, I have a simple question.
Yes,
Did
sir.
the PDSA tool put any additional load on you?
No, not at all. PDCA was a simple, actually my whatever the gaps finding tool, and wherever in my organization, which are the weak points, that is just giving me concern more, not giving me additional burden. Just helping me to work very good with my teams, my all different STS, STLS, and all team to increase my through PDCA, my team building was very much increased. So it was not at all burden for me.
Absolutely.
And, so as a public health person, before I was a doctor working in a civil hospital, but as a public health person, and whenever I come into DTO, and this course helped me a lot to coordinate with my new team who are working in such a remote area and with full of challenges, mobile connectivity and all. There are challenges we are facing. Even though with teamwork, we are trying to improve our notification with our best efforts.
Thank you, Dr. Bhargav Dave. Thank you so much for sparing your time. And now, Dr. Salil, it is time for us to introduce your colleague, your friend, and the second co-founder of CTI, whose vision has been driving us here, who conceptualized it some 10, 12 years ago, the requirement of quality in the public health system of this country. So I will not waste any time, but if I may request you, Dr. Salil, कि आप अपने दोस्त को खुद इंट्रोड्यूस करें.
जरूर. तो फ्रेंड्स, लेकिन मैं इसके पहले एक बात बोलना चाहूंगा. मैंने जो DTOs जिन्होंने 3-4 लोगों ने अपनी बात कही, बड़े अच्छे तरीके से हमको ये बताया कि किस तरीके से हम PDSA या क्वालिटी इंप्रूवमेंट के साथ में हमारा जो नेशनल टीबी एलिमिनेशन प्रोग्राम का एक महत्वपूर्ण बिंदु है या पॉइंट है, नोटिफिकेशन, उसको हम किस तरीके से बूस्ट कर सकते हैं. और इन्हीं सब चीजों को लेकर हम आगे आपसे बात करने जा रहे हैं. तो चलिए हम एक बार प्रोग्राम को थोड़ा सा और आगे बढ़ाते हैं, और मैं आमंत्रित कर रहा हूं डॉक्टर मनोज जैन को. ही इज विद मी, co-chair of SETI, Collaboration to Eliminate TB Amongst Indians. हम लोग पिछले करीब 15 साल, मैंने जैसा बोला, साथ ये सपना जो देख रहे हैं, उसमें मनोज मेरा साथी है. और किस तरीके से मनोज हमसे जुड़े, क्यों जुड़े, क्या चाहते हैं, ये सब हम इनकी जुबानी सुनते हैं. Over to Dr. Manoj Jain, please.
Great, thank you so much, Dr. Salil. मेरी आवाज अच्छी तरह से आ रही है?
बिल्कुल.
Great. Good afternoon to everyone. Good evening and good morning from USA. Respected DDG साहब आ रहे हैं, Dr. Joshi, Dr. Ravinder हैं, Dr. Kiran is here, Dr. Rebecca Martin from Emory, and Mr. K. Dinesh, co-founder of Infosys, all welcome. But सबसे बड़ा welcome मुझे अपने STOs and DTOs को देना है. You are doing amazing work. आप बहुत काम कर रहे हैं और अपन बात करेंगे कि अपन उस काम को how we can make it easier. मेरा नाम मनोज जैन है. मैं एक infectious disease doctor हूँ. यहाँ पे एमरी में यूनिवर्सिटी में I'm a faculty here in US. I want to share my dream and my personal story because you, the DTOs, are the ones who can make it come true. So I was born in India. Then at the age of 10, immigrated to the US. For the past 47 years, I've been coming back to India, to the villages, slums, to North India at AIMS, All India Institute in Delhi, to South India, to CMC Vellore. I was doing work in different areas of how we can help. But then 10 years ago, during one of my visits in the villages, and the night before, I had a dream. It was something that I had learned in my education. It was infectious disease that could make us better. We had treatments, we had medicines, and yet we were not able to do this, to make and treat people. And so the dream was, can I help eliminate, be part of a process to eliminate one disease from one city in one lifetime? The dream was simple. Eliminate tuberculosis from my hometown in my lifetime. I believe it can be done. So with this dream, with Dr. Salil Bhargav, we formed CETI. We even in 2014 met with Health Secretary KC Mishra and talked about TB-free India. I met on several occasions with Health Minister JP Nadda. And we talked about how we could eliminate TB in India. As I started working, this is the single most important thing I learned. That it is the DTO, the district TB officer. It isn't the prime minister. It isn't the SDO. It isn't an NGO. It is the DTO who is the most important fulcrum. He or she is the most important person who can make a district, a region TB free. And so we are coming to you, the district TB officers. In 2019, I was part of the joint monitoring mission and we went from district to district and we met many DTOs and this became more evident. And then we took this further. We developed tools, the electronic PDSA that you have heard so many others talk about. We developed tools such as utilizing quality improvement counselors. You will learn and hear about these more. इसके बारे में आप अभी सुनेंगे, देखेंगे. पर जब really movement हुआ, जब USA ने और यूनियन ने हमको ग्रांट, पायलट ग्रांट आई डिफीट की दी, जो आप बस सुन रहे थे, टेस्टिमोनियल्स, हम वो टेस्टिमोनियल्स आपको इसलिए सुना रहे थे क्योंकि वो टेस्टिमोनियल्स बताते हैं कि जो इलेक्ट्रॉनिक PDSA स्ट्रैटेजी है, जो अपनी क्वालिटी इंप्रूवमेंट काउंसलर्स की स्ट्रैटेजी है, वो आपका काम कम करेगी. It will reduce the work burden, not increase. And so the testimonials are there. We know that we can help the DTOs work together, share knowledge, information, patients को मदद कर सकते हैं. पर फिर pandemic आया और pandemic ने बहुत problems cause करी. Especially in TB, we saw a huge fall in the TB numbers. We know that is where the problem came. Yet, we got together, DDG, TB, myself, Central TB Division, our colleagues at Emory, at WHO, Dr. Kiran Radhe, IIPH, and we said we want to work and to boost TB notification. So I want to take the next Commodore Raman, if that is fine, 5-7 minutes, and share with you the journey that we have. Are you able to see my screen?
Yes, we can see your screen, but as of now, we are seeing some text. Yes, now is the presentation. If you go to the slide mode, please.
Perfect.
Absolutely, Dr. Manoj, we would like to know, and I said, I will talk on behalf of the DTOs at all times. I am batting from that side. Okay.
Perfect.
So please tell us, what is BTN? What are we going to do? How is it going to happen? And why it is being done?
Perfect. So Commodore Raman and Dr. Salil, BTN is a collaboration, multinational, international. Our program, NTEP program, CTD, along with CETI, the NGO in Indore, Emory's Global Health Institute, WHO, and IIPH, all collaborating together for a common goal. How can we increase TB notification? मुझे ये बातें करनी है. Why do we need to boost TB notification? What is TB notification boosting? What's BTN? अपन बोलेंगे boosting TB notification, BTN को बोलेंगे. How to do it and कौन कैसे करेंगे अपन? First and foremost, why do we need to do it? We really have a problem. Our notification went down to 30 to 50%. They still have not achieved what we had in 2019. And so we must work. Commodore Raman and Dr. Salil and our DTOs, I want to take a few minutes and share a graphic with you. ये मॉडल है पर ये आपको बताएगा कि क्या प्रॉब्लम है. देखिए 2019 we were in a baseline where we were, say, one district. So I'm taking one district example, what the monthly notification, ये आपका भी district होगा. What you can see is that we were different levels in different past 2 years. The red line is private notification, blue line is public notification, yellow is total. What we saw was during the pandemic, there was a huge fall, but then we made some recovery, and yet we are still missing even that level. Now that was just model data. Let me see if I can show you our other data. Hang on one second. Now this is from our district in Indore. Dr. Rahul Srivastav is the DTO here. And these are real numbers. You can see baseline. We saw a pandemic and then we saw recovery. What we are saying is we need to work towards boosting. We need अपन को ये numbers वापस 2019 level and higher लाने हैं if we are to make a difference. So we've talked about why BTN. Let's talk about what is BTN. Boosting TB notification is a nationwide campaign. और वो DTOs की campaign है. Public तो देखेगी कि क्या हो रहा है and they'll be amazed. But it's a DTO campaign. It is a quality improvement process that uses the PDSA tool. आप देखेंगे वो PDSA tool क्या है. Also, you will get a training certificate from CTD, WHO, Emory, and IIPH. इसका थोड़ा time लगेगा पर ज़्यादा नहीं. It's a rapid 2 months, 1.5 hours per week. How will we do it? We will use innovative tools. We will use quality improvement counselors जो आपको assist करेंगे. They will be engaging you. And जैसे अपन आज मिल रहे हैं, Fridays at 4:30 to 6, we will meet on regularly for the next few months. आपने देखा होगा, you must have heard this PDSA क्या है. You will see how easily we can make an aim statement. We take the aim statement and then we turn it into action. That is what's incredible. But we will also have fun. Commodore Raman, you and I have been teaching some of this. मुझे बॉलीवुड भी अच्छा लगता है. मुझे एक्चुअली ये भी मजा आता है कि किस तरह से अपन इसको शेयर कर सकते हैं दूसरे लोगों से. So what I want to do, my screen just went off. 1 second. I'm going to share my sound.
And the best part is Dr. Manoj के अभी थोड़ी देर पहले Dr. Bhargav Dave ने एक बात कही. He said that the PDSA helped me make my team stronger.
Yes.
If the DTOs missed it, I would like to reiterate the statement that he made. Your screen is on, Dr. Manoj.
Okay. So I'm going to play a video here and I'll share with you what I mean by this. You all remember this scene. This is Bhuvan. Commodore Roman, what do you think?
Well, this is what I see, Dr. Manoj, a under-resourced team, underprivileged team with just grit, motivation, and commitment, who came in together from all varied aspects of life and just performed as a team. I don't know if this is what you had in mind.
Absolutely. You, the DTOs, you are Bhuvan. You are the team leaders for the district. You pull in all of the other folks. And we are helping providing the tools, like the electronic PDSA tools that you will be learning. We learned all this. I want to credit I Defeat project funded by USAID and Union. Many of you attended and are part of this an ongoing management course where we piloted the idea. And here is what is an example of the success we have seen. अब आप देखिए, हमने PDSA आयोग्य साथी ऐप को अप्लाई करा 3 states में, and see the difference in the uptake over months that you can see by 0.47 to 13%, whereas rest of India had not achieved that success. This is what will happen with joining the boosting BTN. Your increase in the boosting, your notification will increase the same. And we know this because we have some of the data, lots of details here, but you can see through the data that we have been able to increase notification 20-30% or more. मुझे finish करना है कि अपने expected outcomes क्या होंगे. What do we expect from all this? Nationwide, TB notification will increase. We have to get it to the stage 2019 and higher. DTOs will be engaged with the quality improvement PDSA और आपको सब national awards में boost मिलेगा, momentum मिलेगा. And if I had to predict what will happen, this slide can predict. Commodore Raman, we have experienced baseline, we have experienced the pandemic and recovery. And now we are going to experience boosting. This is the impact that we want to help every district achieve over the next 3 to 6 months.
So tell me, Dr. Manoj, that at this point in time, there may be much apprehension and hesitation in the minds of the DTOs, and I am talking from their side. Do you think it is okay if I bring in somebody else to keep pushing, keep backing the argument that you are making? If you feel so, just let me know. I have STOs and DTOs waiting in line. So
absolutely. So I'm going to just show 2 more slides.
okay.
And then I will finish up. And time course, as we've said, we have the week. We start on June 1st, June 31st, July 31st. We will finish our PDSA. And then who will be doing this? The BTN will be done by our team working together. We have the leadership, myself, Dr. Bhargav, Commodore Raman that you have. We have faculty international group. We have Ken Castro, Dr. Pratibha Kohli, Mohan Kohli, Dr. Amish Pathak, Edwin, Sangeeta, and Pooja. And then we have our team leads. These are our team leads who will be working very closely with you. And then the very important points of contact are your counselors who will be working with the DTOs one-on-one, 62 of them who will be working with you. So with that, I want to ask Commodore Raman, let us hear from others and let us begin to see the experience of other STOs and DTOs.
Thank you so much, Dr. Manoj. And now I would like to call upon STO of Punjab. Dr. Bhaskar, agar meri awaaz aap tak pahunch rahi ho, Mr. Edwin, please unmute Dr. Bhaskar. And DTOs and friends, why did I request Dr. Bhaskar to join us? You know, Punjab was part of the journey with us when the COVID wave was at its peak. The entire TB program organization was under a lot of stress. And if this was not enough, there was a strike of the NTEP staff when the journey was going on with us. At this point in time, what do you expect? Do you expect people to continue subscribing to this course? Well, let me call Dr. Bhaskar himself, the STO of Punjab, and may I request you, sir, please share your experience, your journey, the feedback from your state with all the district DTOs here. Dr. Bhaskar.
Thank you very much to the whole STEAM group for giving me the opportunity. It's true that we all face the challenge of COVID pandemic, and on the top of that, Punjab faced the challenge of strike for about 2 months by the staff. But we continued. We continued with the rigor. Our DTOs who attended this PDSA program provided a very positive feedback. You know, we have been trained as a clinicians, but to run a program, you need managerial and leadership skills as well. That is this course excellently. So from this course, the DTOs learned how to manage their day-to-day activities, how to motivate their teams, how to lead from the front, and that showed the result. We quickly caught up and our notification increased along with all other indicators. The feedback I have received is this PDSA is not applicable or confined to TB program only. It can be applied to any program. In fact, we can apply it to day-to-day challenges we face. Quality program which build your leadership and managerial qualities and provides you a platform using process charts, flows to follow, breaking down the problem, finding the solutions, applying it, and then studying it. So this is an excellent program, and my team has spoken very high of this course. Thank you so much.
Thank you so much, Dr. Bhaskar. I wish to acknowledge and the efforts and everything that your team has put, and the DTOs of Punjab and your leadership was most inspiring for us. Thank you so much. And now it is time for me to ask for another wonderful DTO who's with us. may I call upon Dr. Sheila Aditya to share his perspective and guide us and tell us what his journey was and how his journey was.
Hello, good afternoon, sir. I am Dr. Shiladitya Paul. But sir, I want to mention you again that I am the DTO of 2 districts of West Bengal.
Bag Bazaar and Strand Bank.
Yes, sir. I am DTO of 2 districts. Bag Bazaar
No.
Strand Bank.
I am sorry to interrupt you. He is the DTO of 2 districts, Bag Bazaar and Strand Bank. And when every other DTO was working on only one PDSA, Dr. Sheila Aditya Paul said, I will do 2 PDSAs from both the districts. And sir, it is such a pleasure to have you amongst us. Thank you, sir. Go ahead.
Yes, sir. I have completed the PDSA course in the last season for both the districts. And I found the course is extremely helpful for us. As my previous presenters and STO Punjab sir has also mentioned, that we are doctors basically, but we don't have that level management training or IIM or B school level training. But your course, which CETI has brought to us, that's basically B school like training, and you have good faculties who have trained us and taught us on the management level. Our management skill has improved a lot after doing this course, and also it helps us in managing our team, which you have just shown in that Lagan movie slide. And sir, my PDSA cycles that I have the private notification, as you have already mentioned that during COVID there was a sudden dip in the notifications. Earlier we used to have almost 150 to 160% of the CTD target of private notification, but after this COVID it has dropped a huge. And after doing this PDSA cycle, I found that 5 to 7% increase has achieved in both the districts. So thank you, sir, for bringing us course, and thank you to your QIC who has helping us a lot in doing this course.
Thank you, Dr. Sheila Aditya. I know you are traveling, but you still considered to join us. So with this, Dr. Manoj.
Yes, I'll make a comment on that, Dr. Sheila Aditya. Just imagine if we did what you have done and replicated across the entire country, and increasing 5 to 7% every 2 to 3 months, which you have done in that short of time. And what that shows is that there is a great room for us to improve. And if we work together, we can definitely do it as a nation.
कमोडर रमन, मैं आप दोस्तों की सबकी बात सुन के मुझे बड़ा मजा आ रहा है और बहुत अच्छा लग रहा है, लेकिन मुझे ऐसा महसूस होता है कि इस प्रोग्राम के लिए हमारे साथ और बहुत सारे लोग जुड़े हुए हैं, और न सिर्फ डॉक्टर्स या पॉलिटिशियंस, बहुत सारे भांति भांति के हर तरह से एनजीओस, एक्टर्स और भी काफी सारे लोग हैं जो इस प्रोग्राम को सफल होते देखना चाहते हैं। उन्होंने अपनी शुभकामनाएं भेजी हैं, लेकिन उसमें से कोई खास व्यक्ति है जिनके बारे में आप बताएंगे और उनको हम सुनना चाहेंगे। दोस्तों, डीटीओस, दिल थाम के बैठिए, देखिए कौन आपसे बात करने आ रहे हैं।
थैंक यू डॉक्टर सलिल। Ladies and gentlemen, Mr. Vivek Oberoi, a Bollywood actor and a philanthropist, he wanted to be with you at this inaugural day, but he is traveling to Dubai and to California from there, so he could not come, but he shared his video message and he has promised in the message that he'll be there for the closing ceremony. A wonderful gentleman to the core. He has been associated with the cancer patients, with the children who have been saved from prostitution, and many other activities that he's been involved in. Let's hear him and his message for you.
Namaskar, salam, sat sri akal, and a very warm welcome to all the district TB officers, our DTOs, who have joined this collaboration to help us eliminate TB in India. Our Honorable Prime Minister, Shri Modi ji, has encouraged us in the eradication of TB in India, and you, the DTOs, are the frontline warriors in this health battle. Desh jeetega, TB harega. This is our motto, and with you as our guiding force, the battle will surely be won. With the ongoing pandemic, our focus on TB has reduced greatly. And so your challenge lies in putting the conversation on TB back into the spotlight and increasing awareness. Through this training, you will learn about using the unique quality improvement tools similar to Plan, Do, Study, Act. COVID has shown how our community can rise to the occasion. We have so many real life heroes. हमारे लिए आप लोग पर्दे से कई ज्यादा बड़े हीरोज हैं, असली हीरोज. You are the real heroes of today. It is your work and your dedication that actually saves lives. Though I'm not able to be with you in person at the start of this journey, God willing, I will join you in 3 months. I congratulate the principals, Dr. Manoj Jain, Dr. Salil Bhargava, Commodore Raman Arora, and from our government, Dr. Rajendra Joshi and Dr. Ravindra Kumar. I wish all of you great success in meeting this new challenge.
So thank you to Mr. Vivek, and he has not been able to be physically here, but he has sent his greetings directly to you by name for this program. And it is, yes, Dr. Manoj, please.
Look, Commodore Raman, I was going to say, Vivek, I have had multiple conversations. He's a good friend. And he was so amazed by the work that we were doing. And when I asked him, would he be willing to speak with our DTOs, he was 100%, without a doubt. He said, for this, Manoj, I will definitely do this. And so the DTOs, you may not realize it, but jo aap kaam kar rahe hain, the work that you are doing, people across the nation can feel it. And they are so gracious. So again, I want to thank our DPOs.
Thank you, Dr. Manoj. There is one more, besides the heroes that was on the screen and the DTOs, the actual heroes, there is another hero in the form of WHO consultants who have lent us their support at all times, and their leadership has been such a strong pillar of support with us. Dr. Salil, may I request you कि आप डॉक्टर किरण कुमार राडे को इनवाइट करें.
बिल्कुल रमन, मैं एक किरण को तो मैं इनवाइट करूंगा, बट मैं एक छोटी सी बात कहना चाहूंगा कि मैं पिछले करीब 25 से 30 साल से टीबी प्रोग्राम के साथ जुड़ा हुआ हूं, अलग अलग रोल प्ले कर रहा हूं, लेकिन हर जगह पे, हर परेशानी में WHO कंसल्टेंट्स हमारे साथ रहते हैं, और कुछ भी जरूरत हो स्टैटिस्टिक्स की, कुछ जानकारी की, कुछ सपोर्ट की, कुछ कनेक्शन की, गवर्नमेंट ऑफ इंडिया से बात करना है, स्टेट लेवल अथॉरिटी से बात करना है, हमारे सारे WHO कंसल्टेंट्स हमारे साथ रहते हैं, और मैं उनका आज यहाँ पर आभार भी करना चाहूंगा. उनका शुक्रगुजार है हमारा प्रोग्राम पूरा. बट आज उनके जो टीम लीड हैं पब्लिक हेल्थ प्रोफेशनल किरण कुमार राडे, मैं अब उनको इनवाइट करने जा रहा हूँ. ही इज ए NPO TB एपिडेमियोलॉजिस्ट एट WHO इंडिया. किरण, हम आपका स्वागत करते हैं, और मुझे मालूम है, इनफैक्ट जब हमने ये प्रोग्राम, ये जो आइडिया कंसीव कर रहे थे, तो किरण हमारे साथ शुरू से ही थे, और उन्होंने हमें कई जगहों पर गाइड किया कि हमको किस तरीके से इस प्रोग्राम को करना है, कैसे आगे बढ़ना है. डॉक्टर किरण कुमार राडे, मैं आपका स्वागत करता हूं, और आपको मैं आमंत्रित करता हूं, आप अपने विचार व्यक्त करें. प्लीज से फ्यू वर्ड्स टू अस. किरण, प्लीज.
Thank you, Dr. Salil. I very well recollect when we met first time, especially when Dr. Manoj was trying to bring this concept of not only PDSA, but using that the TB-free initiatives. Though historically, the stance of all the experts globally was that it's very, very slow progress, and it's very difficult to accelerate the TB decline, incidence decline, due to various reasons, being a chronic disease, being a infectious disease with huge implications, but not much good tools in terms of vaccines or in terms of diagnostics and perfect treatment. But this particular thought has been overcome by positive thinking, and Dr. Manoj is one such pioneer, very good friend of mine, and joined and supported by experts like Dr. Salil, and with huge enthusiasm that Commodore brings into, along with other experts of management, Dr. Kohli, and other experts from other public health institutes. So this particular initiative will go a long way, and we have already heard the similar initiatives and the learnings and experiences of our DTOs and STOs who are the forerunners. So with a specific task in this round of boosting TB notification, I think we will be in a position 3 months, 6 months down the line to see the huge boost in notification. And this particular initiative will be one of the major, I can say, a forerunner to boost and augment that effort to bring back the program to the pre-COVID level. From our side, of course, WHO consultants and all our colleagues will always be there in the whole journey. And I'm looking forward to the sessions wherein there will be exchange of ideas and the efforts will be augmented for boosting TB notification. With that, I wish all the best for this program, and Countess WHO will be there not just for monitoring, but also for every possible activity to boost TB notification and end TB in India. Thank you.
Thank you. Thank you so much, Dr. Kiran Kumar. And I would like to place it on record and acknowledge Dr. Kiran Kumar, your polite demeanor, your calm and soothing voice, and your inspiring vision and words to us every time you attend our sessions. And it is so heartwarming and so inspirational for us that, you have said that, the support from WHO consultants will be there. We are backing on that support, and it is so kind of you to be there every time and each time. I am sure Dr. Manoj or Dr. Salil may also like to join in
Absolutely.
Yes.
Absolutely, Dr. Kiran. Our friendship goes a long way, but what really drives us together is our common dream and vision. And your 125, 150 or so WHO consultants are instrumental. वो अपने DTOs के साथ काम करते हैं, और आपके जो WHO consultants हैं, they understand also the PDSA process. वो काफी sessions attend कर रहे हैं उन्होंने. So this is really good that we have the mixing together, and we can now really get that boosting of notification back to the 2019 level and then higher.
Manoj, over to you, Manoj, now to invite.
Now it is time to welcome our international friend, colleague, participant, guest, Dr. Manoj. What category should we, put Rebecca in?
Sure, all of those categories. It is my great pleasure to have one of a great friend of India, a great friend of TB elimination, Dr. Rebecca Martin. She is the director of the Emory Global Health Institute. They are funding us. They are sponsoring our program. We are very grateful. Dr. Martin is also the vice president of global health at Emory University, where I am also a faculty there. She has worked for 22 years at CDC, the Centers for Disease Control and Prevention, and has international experience, including spending time in India. Rebecca, we are delighted for your support, and would love to hear your thoughts and comments about the global journey of TB and your ideas of what we can do better.
Thank you so much, Dr. Jain, and thank you, Commodore Raman. Good morning, good afternoon, and good evening to everybody and distinguished participants. Thank you for inviting me to be part of this inauguration today. The previous WHO Director General, Dr. Margaret Chan, made a comment about the End TB strategy, the global strategy to end TB. And her remarks were that everyone with TB should have access to the innovative tools and services they need for rapid diagnosis, treatment, and care. This is a matter of social justice. And this is what you are doing. The End TB strategy works to reduce TB incidence by 80%, TB deaths by 90%, and to eliminate catastrophic costs for TB-affected households by 2030. The integrated patient-centered care and prevention is a critical part of this strategy. The key component of early diagnosis, drug susceptibility testing, screening of contacts, and high-risk groups. And this is where your important work sits in being able to achieve both the elimination of TB in India and the global goal of ending TB. As we've heard, there has been devastating impact of the COVID-19 pandemic on TB detection and mortality. And I want to spend a few minutes to talk about this, but also as we're coming and learning from what we have been responding to in terms of the pandemic. First of all, we know that the progress towards the global TB 2022 targets that were established at a UN high-level meeting in New York are off track. TB services have been disproportionately affected compared to many other health services. And the first time in 10 years, the estimates of TB mortality have increased. The World Health Organization estimates that nearly 10 million people developed TB in 2020. However, only 5.8 million cases were diagnosed and reported. Thus, the importance of what you're talking about of boosting TB notification. Stop TB reported a 20% reduction in the diagnosis and treatment of TB globally. But the largest reduction was reported from India, Indonesia, Philippines, and China, countries that had major COVID-19 pandemics and epidemics and disruptions in the health service, as we see, and you know most directly from your frontline experience. And we know the frontline workers have been most impacted, including yourselves. And this has led to an estimated 500,000 TB deaths around the world. The path now is how do we get back on track? And that requires both short and long-term actions that need to be implemented now. The use of data to make evidence-based effective program decisions is so critical, and this is what you are doing as a DTO. Also, using what India has learned from the pandemic preparedness and response to date is so critical. Improving the case detection and reporting is urgently needed, and innovative tools and opportunities to improve patient education and contact screening are important. And these are all the things that we're talking about as part of this boosting TB notification. There is an urgent call within India and globally for the need to revive TB outreach and services. In closing, I'd like to say that this inauguration of boosting TB notification is an integral part of India's goal to eliminate TB. We at the Global Health Institute at Emory University believe in the importance of the implementation of quality improvement processes that can increase coverage and reach those while decreasing missed opportunities and reducing barriers to achieve the ambitious but achievable goal to eliminate TB in India by 2025. It has been moving today to hear about the experiences and the incredible work of the DTOs during this inauguration. And we are honored to be part of this today. And most importantly, we are committed to being part of boosting TB notification in India. I was in Germany in 2017 at a Stop TB meeting where Prime Minister Modi announced to the world that India had set the goal to eliminate TB in India by 2025, 5 years earlier than the global goal of 2030. As Dr. Manoj Jain has said, you sit at the fulcrum to make this happen. And closing, in the words of Nelson Mandela, it always seems impossible until it's done. So thank you for all of your work. I wish you all the best, and thank you so much for letting me be here today with you. Over to you, Commodore Raman.
Thank you, Ms. Rebecca. Thank you so much for your kind words. And as usual, your presence has been very graceful. It has, lightened up and colored the entire virtual room. Thank you so much. And we are very thankful to you, Dr. Manoj. May I request you to, yes.
Sure. And Dr. Martin, this is so timely. The collaboration with Emory, with CTD, with institutions such as CTI, that we're able to bring knowledge and skill sets and tools all to the front doors of patients who may be living in a slum, who may be living in a village. And that's what's amazing. Yes, the pandemic has caused us disturbance, pain, suffering, but it has also opened up an opportunities. The fact that we're able to communicate virtually as if we are sitting in the same room, that is a great credit. And the fact that Emory Global Health Institute recognizes that and is taking advantage and engaging over 400 DTOs who have registered to be part of this initiative. Imagine that, all working with the common goal to achieve TB-free India, to increase notification in the process. So Commodore Raman, over to you, and let's hear from someone who is outside of the TB world and who can bring us great insight and has tremendous work done on quality.
Thank you, Dr. Manoj. It is time for us, ladies and gentlemen, to welcome Mr. K. Dinesh. Mr. K. Dinesh does not need an introduction. He is the co-founder of Infosys, the tech giant that we have in this country. And what is the relevance of his being the co-founder and him being the head of quality information systems and the communication design group in Infosys? He will bring out to us the parallels in quality in the business world and how he created and put the foundation of Infosys and what he expects us can happen in the public health system. So I'll not waste any one of your time. May I request Mr. K. Dinesh to please enlighten us with his kind words.
Edwin, please unmute him if he's on mute.
Can you hear me now?
Yeah. Very well. You are very well.
Yes, sir, we can hear you.
So, thanks, Commodore Raman Arora, Dr. Manoj Jain, Professor Salil Bhargava, and all the dignitaries who are there connected with us. It's always my pleasure to be with all of you on such a momentous task that you are all attempting, and I'm sure the success only will follow, because it is only the beginning that matters, and the beginning has been done very well with such great words from your leaders, experienced leaders. I'm only a software guy, but I happen to have something related to healthcare, and I came in contact with Manoj Jain and Commodore Raman Arora and others when this program was being initially thought of in the early stages, because I used to visit Indore. My wife was born in Indore in the military hospital in Mau, and I used to visit there, and in that connection I met with Dr. Manoj Jain, who was the quality expert, and who is the quality expert even now. And the key is, when we formed Infosys, I want to focus more on the message that you all want to hear about quality, because that is what you people want to know from me. I don't have the expertise of Rebecca or many other experts who have talked about the communicable disease and TB, all of that. I don't have. I'm not a doctor. I'm not a communicable disease doctor, but I'm a quality doctor, you can say, in whatever little way I know. But in 1981, when we formed Infosys, 7 of us put together 10,000 rupees as the corporate capital with Mr. Narayan Murthy as our leader. We had a vision, because I'm quoting this here because you have a vision to eliminate TB by a certain date. And we had a vision to build a globally respected company and providing business solutions with the best-in-class people and with a set of values. Customer delight, leadership by example, integrity and transparency, and fairness, and excellence is what we wanted to deliver. So these were the quality principles we followed, because Edward Deming, the quality guru, said very clearly why do you think quality journeys don't succeed? And if it has to succeed, the constancy of purpose is very, very important. And in this case, in your journey, I defeat that you are all trying to do, that constancy of purpose has been clearly defined, that you have to eliminate TB by 2025. Though you may have setbacks, temporarily due to other reasons, but your goal is very clear that you want to achieve that. So that is very, very important. And we also followed another principle Dr. Rebecca was talking about. In God we trust is what we said in Infosys. The rest of them have to bring data. Because data will speak. Otherwise, it is all perception. Some DTO is doing well, this district is doing well, this is not doing well, but data will speak. And that's what you have focused on. And that is very important in your journey. I see that as a clear focus. In God we trust. Rest of them have to bring data to discuss their point. And we followed quality principles to build Infosys from 7 people organization coming from India in 1981, when I was watching that Lagan movie, that title that you guys were showing there. Lagan, Infosys story is similar to that. 7 ordinary people who have not run any business and trying to say we'll create a globally respected company and trying to export software to developed countries like America and Europe and Japan, Australia, all of that. It was just a dream, one would have thought. But we came as a team, we had a dream, and we had a set of values which made us think of what we needed to do. But in that, these are all great things to think about. But the key thing is quality. We have to earn the respect of the customers of what promise we have made and what we need to deliver. And in your case, your promise is you want to eliminate the TB in the patients that who know they have a problem and the patients who don't even know they have a problem. So in the process, you have to make sure that you deliver on those promises continuously. That is what is required. And we use the quality principles of ISO 9000, CMM model. CMM is capability maturity model of NQA, Malcolm Baldrige National Quality Award. All of these principles we followed and achieved the highest levels of quality to reach where we were, including Six Sigma we implemented. So what is the net result of this? What is the net result of all of these? These are all concepts you may say, but as a business person, that people who would measure Infosys, the clear goals for us was, is our business growing? And of course, in your SETI case, you don't want disease to spread more. You want to contain it. That is the goal. But in our case, we had to make sure that same customers come back and say, we want more business to be given to you because you deliver on very high quality. That is what would happen in your program also. When you treat a patient and he becomes defect-free, TB-free, he will go and go to this DTO, he will eliminate, you don't have to worry about the stigma that is there with TB. How do I tell people I have TB? So that is what you are creating in the mindset of people. So that is what would happen in terms of end result. In our case, the repeat business went up to 85-90% when we implemented CMM, ISO, Six Sigma, all of those things. In the process, the profits went up, employee satisfaction went up, share value went up. So all of those byproducts that you will see in your journey, you will see, because you are doing a journey which will prove to the rest of the world that India can achieve many other things, and even in the TB elimination, they can eliminate it by 2025. And now, what are the principles you are following? When I see all the presentations, DTOs coming enthusiastically and sharing their experiences here, I got reminded of what we were doing in Infosys. So we had to bring from 50 different locations where we had operations, not only in India, outside India. And they would share their journey of what they have done, where their problems were, and how they solved it. In the process, the team learned from each other. And that's what is happening in this city program that you're all embarking. So the team has to share. And now I want to share one experience with you, which I have shared in the earlier programs. I have been associated with this last 15, 20 years, and I've shared some of these experiences with all of you. But for the benefit of all of you, I had a unique meeting with one of the human beings on Earth who is still there, who had been to moon, one of the two people who had been to moon and who came back to India, back to Earth, and only living person right now on Earth who has visited moon and back is Ed Aldrin, an astronaut. So we were asking him when I met him in New York, why did you guys do this journey? You knew last 9 missions had failed and you were trying to attempt, you may not come back. I've shared this with many of you, and his answer was, I know we were confident we will be able to reach back. We will achieve the goal of landing and coming back because we had full trust in our mission control that they will bring us back successfully. And he also said the reason we were trying to attempt there was, even if for some reason we don't come back, but the man has explored what are the possibilities that exist in space and the very fact, in the future. And that's what we were trying to tell the humankind in 1969, because John F. Kennedy had defined this as a mission goal, like Modi has defined a goal for all of you, 2025 TB should be eliminated. So that is what they were trying to achieve. And in the process, what has happened? You and me, all of us are meeting together with satellite connection, mobile connections, GPS, UPI, so many things that have happened. When the plague hit the world in 1919, none of these existed. I don't know how they solved it. Whereas you have all those things available to you because 1969, these guys pioneered to land on moon. Now, a parallel to that is for you guys, you people, what will happen when you people land and defeat TB in 2025? There are many other benefits that will come to the nation and to all of you, more importantly to the people who are affected by TB and their families. Because TB to me is a poor man's disease, though rich people also get it. Middle class and poor, everyone it affects. So in the process, you have solved the problem for many, many human beings. And that is what is happening. That is the main reason you need to do this, and that is very important. Now, what will happen because of SETI? When I was going through my CMM level 2, CMM is capability maturity model of software, similar to what SETI has come out with a model for you for PDSA. In software, they had defined 5 levels of quality. We followed all of that and made sure that Infosys reached CMM level 5, because of which our export competitiveness went up very well. So in the process, all I'm trying to say is level 2 tells us you have to understand the problem. That is what is the notification you're all talking about. Understand the problem. If notification goes up, then you can solve the problem. People don't know they have a problem. If notifications are not issued, who are you going to address the problem with? So that is what had gone down for some reason temporarily. You're bringing it back and make sure that it is on the right path. So that is where I like the program, that many experts have talked about. Rebecca Martin has talked about from memory. Dr. Kiran Kumar Rode from World Health Organization. Even the Bollywood has subscribed and said it needs to be done. Vivek Oberoi has talked about it. And now you have given a good mnemonic name, Boost TB notification, also very easy to remember. Simple goal is boost TB notification as you go along, which has dipped a little bit. If it comes back, then the path to eliminating TB will happen. So all I want to say is I don't want to take up too much of your time, but George Bernard Shaw in the 1960s, in the industrial age in 1800 was asked, if there is men, material and money, if men, material and money is available, which one of these three would you need to succeed, in enterprise? So his answer, knowing the wise man he was, his counter question was, if there is a three-legged stool, which leg is important? Now I want to ask all DTOs to answer this. I know you have the answer. If there is a three-legged stool, which leg is important for you to balance? So if men, material, money, if money is there, is it enough? No. If men is there, enough? No. And what else is required then? So then all three, his answer is, if there is a three-legged stool, all legs are important for you to balance. That is what you learn in this PDSA cycle. You have to do a balanced journey of doing the journey with men, material, money, strategy, tools, all of that have to come together to solve this problem. And now the key thing is, why should you have to learn all of this here? Why can't you do it yourself? That is the question that many of you may have. Why do you have to learn all of this? This is like ready-made recipe, cooked food that is available for you to take and say, enjoy and make sure that it TB. Why reinvent the wheel? You will put your own effort to find new problems, new way to solve it. That is okay. But why reinvent the wheel? That is where coming together, you have got the well-tested, well-oiled, tested by experts, endorsed by experts, and all of that is available to you so that you can use this to solve the problem that you have. And Edward Deming, as I said, has clearly said, the guru of quality, the constancy of purpose is very, very important in quality. That is where the most quality efforts fail, because there is no constancy of purpose. Today it is this, tomorrow it is something else, tomorrow something else. DTOs have to be very focused on what problem they are trying to solve. What is the purpose of doing it? By when we have to achieve? How? All of you will invent in the guided way that you are being given to solve this problem. And now I just want to share one or two experiences if I have time, Raman. One experience is, when I was going through ISO 9000 certification or CMM, one of them, the assessors would ask me, how many people are there in quality? What would be your answer? What would be your answer in SETI related or in DTO? Or each one of you DTOs were to answer that question, what would be your answer? How many people are there in quality journey?
So I'll say this, Dinesh, companies and hospitals hire a single person who's a quality officer. And I'm really against that idea, because everyone should be a quality person.
8%.
That is the answer. That is the answer that I gave to the assessor. At the time we were about 10,000 people in Infosys. All 10,000 people are there in quality. I'm glad you answered the same way. I learned something from you also today, in case I have missed. And then next question he asked was, how many cars are parked in the parking lot? He used to tell in America when he does this assessment, how many cars are parked in the parking lot after 6:30 or so in the evening, after office hours. That he would go and measure to see the quality level that is being delivered. If there are more people there doing extra hours to deliver quality and fixing all the problems that have happened already without knowing how to do it, all the time reinventing the wheel, then that is not quality. So if there are very few cars in the parking lot, then you know you are delivering quality. Like that, you should have very simple measures to see. DTOs should go home, and all the people who are working for them should go home, and the patient should rest in, very peacefully, and make sure that it is a journey that everyone enjoys. That to me is delivery of quality in case of the TB notifications that need to be done. So that with that note, I want to end. I want to thank all of you for giving me this time opportunity to interact with you, speak to you, and especially Manoj Jain, Commodore Raman Arora, Salil Bhargava, and all the experts who are there. I'm sure this will be a very successful program, and all of you will be very happy to be part of this, learning from each other and making sure others learn from you. And thank you very much.
Thank you, Dinesh. Thank you so much. And Commodore Raman, we have our DDG, Dr. Joshi and Dr. Ravinder here. If you and Dr. Salil would kindly ask them, they were in a very high level meeting and they've been joining us now.
May I request Dr. Salil Bhargav to please invite both the dignitaries to share their views. Yes, Dr. Salil.
You might be on mute as Dr. Salil comes on. Yes.
या हम डॉक्टर जोशी का स्वागत करते हैं हमारे डिप्टी डायरेक्टर जनरल नेशनल टीबी एलिमिनेशन प्रोग्राम के। दोस्तों, आप सब जानते हैं कि नेशनल टीबी एलिमिनेशन प्रोग्राम विश्व का सबसे बड़ा और सबसे सफल प्रोग्राम है और इसमें कितनी परेशानियां या कितनी चीजें हमको देखना पड़ती हैं, लेकिन इसके बाद भी ये एक सक्सेसफुल तरीके से चलाया जा रहा है सेंट्रल टीबी डिवीजन के द्वारा। और हमारे बीच में डॉक्टर राजेंद्र जोशी और डॉक्टर रविंद्र कुमार उपस्थित हैं, हम उनका स्वागत करते हैं। और मेरे ख्याल से मैं सीधे डॉक्टर राजेंद्र जी जोशी जी को आमंत्रित करता हूं, जिससे कि हम उनसे इस प्रोग्राम के बारे में, टीबी नोटिफिकेशन के बारे में सुन सके। डॉक्टर राजेंद्र जोशी, प्लीज। Edwin, please unmute him. Edwin?
Yes, sir. I am unmute now.
Yeah, great, sir. Welcome, sir. Good evening.
Good evening. Thank you, Salil Bhargava. Thank you, Manoj Jain ji and all the dignitaries. And good evening to all the DTOs. I'm very happy to be part of this initiative. I was really excited when SETI came up with this focused training for DTOs using PDSA model, because this is one of the areas where as medical doctors, we don't get trained. We are all assigned multiple roles, but unless we are trained, some of us may do well, some of us may face challenges. So I went through the details of the program and I had the opportunity to participate in their one more longer program for DTOs in the previous month. So this is really a exciting aspect, and I'm very sure it will help us to build our capacity. And coming to TB notification, as you are all DTOs, I need not tell you that how important it is. See, all our assumptions, calculations, everything depends on the notification. How much medicine I should do, how much test I should do, whether I'm progressing in a correct way, whether the district or state is performing better than last year. Everything depends on the notification. So notification is one of the important, I would say it is the most important data point in our whole system of TB patient. All other things emanate from that. So it is very important that we should know how to improve the notification rate. And if I'm progressing, I should know how to enjoy the process also. That was one of the beauties I saw in the program, that it is not just a theoretical model. There is a lot of involvement of the, I wouldn't call you students, you are all quite senior and quite educated. I would rather call you as colleagues. So it is going to be a very, very good opportunity for us. And we are also looking at it as one of the, what you call pioneer programs, if we can show the improvement. Because attending the program, see, as a doctor, I attend many CMEs, conferences, but how much I have learned from it at the end of the day, and what is the change in my behavior. That is what matters. So what we are also going to look at is what is your feedback. Of course, I'm sure SETI will look at it and that they will take that. But we are also looking from CTD side, what is the current notification and how much is the improvement. Then involving you all in the process, I would like to know what else we can require SETI, which other thematic area where we want their help to improve that particular thematic area or particular gap. So notification is one of the earliest but most important aspect. That's why I'm very happy that they have chosen notification. So on behalf of CTD, I thank the whole team of Commander Arora, Bhargava, Manoj Jain, Dinesh, and all others. And I also congratulate all the DTOs who are showing interest in this program. So looking forward to seeing that the program is very fruitful one, very successful one. Thank you, sir. Thank you all. Thank you, sir.
Thank you so much, Dr. Joshi, and so much contribution all of you have been making, and Dr. Ravinder also, if he's with you, we would definitely want to thank him. And if he's there, if he wants to say a few words, Dr. Ravinder, if you're there.
Yes, I'm there. Good evening to all. Dr. Manoj Jain, Commodore Raman, Dr. Salil Bhargava, DDG sir, and all our DTOs, 300 plus DTOs who joined all over the country. So it is a one of kind of a program which help our district TV officer how they can boost up their notification in their particular district. So, each and every district officer know locally what is the status of their district, what is the level of notification in their district. Sometimes they know what are the challenges, but they are not able to plan how to remove these challenges. So this kind of capacity building will help these district TB officer to plan their activities, how they can boost up their notification. So I must congratulate all you to joining for this particular training program, and also congratulate the whole team of SETI for organizing this kind of meeting. And I see that this is going to be help in program in the long run in boosting the notification. So thank you all. Thank you very much.
Thank you so much, Dr. Ravinder and Dr. Joshi. And what should our DTOs expect? I don't want to go much beyond our time, but tell us, Commodore Raman, and let us finish with the national anthem.
Yeah. Thank you, Dr. Manoj. All it remains for me is now to thank everybody for their graceful presence. Thank you, Dr. Joshi, DDG TV, for being here. I know you've been busy. Thank you, Dr. Ravinder, for making it possible to be with us. Thank you for your kind words of inspiration. We will definitely make sure that your expectations, we live up to it. And of course, I also want to thank in absentia to Mr. Vivek Oberoi, actor and philanthropist, who sent his video message to us, giving his kind words and good wishes to the program. And he has promised that he will be with us and will join us towards the closing ceremony. And I also thank STO Punjab, Dr. Bhaskar, Dr. Shakti Singh Rathod, DTO Khandwa. My heart goes out once again to thank Dr. Kiran Kumar Rade for sparing his valuable time and for sharing his thoughts with us. My thanks to DTO Strand Bank and Bagh Bazaar, Dr. Sheila Datya and Dr. Bhargav Dave, DTO Dang. My special thanks to our foreign, the foundation, Dr. Rebecca Martin, Director of Emory Global Health Institute, and of course, Mr. K. Dinesh, co-founder and Chief Quality Officer at Infosys. And with this, all it remains for us is to close this session. And there is no better way to close the session than to have the national anthem going. May I request you to freeze in your places or rise for the national anthem, and may I request Dr. Salil to do the needful.
Yeah, मैं आप सबसे रिक्वेस्ट करूंगा कि अपने अपने स्थान पर खड़े हो जाएं. Please stand up at your places. National anthem, please.
Thank you all.
हमारा आज का कार्यक्रम यही समाप्त होता है. आप सबका बहुत बहुत धन्यवाद. Thank you.
Thank you,
Thank
everyone.
you all for sparing your time.
Yes.